Hi, everybody. This is Dr. Patricia Coughlin, and this is my last video of 2024. And what I wanted to talk to you about today is how there is coherence in the unconscious. And this is ultimately what we are endeavoring to discover. What is the unconscious meaning? What is the unconscious reason that the patient is suffering in very specific ways, right? This is not random or coincidental. What kinds of symptoms the patient has. Now, of course, they come in to our meeting very confused about why this is happening to them, or they have a mistaken idea about the cause. So when we help patients to identify the triggers to their symptoms, we begin to inquire about the feelings that are being evoked in that situation. In almost all cases, we're going to see anxiety and defense coming into the picture. We're going to help the patient see how they defend instead of feel, how that causes or exacerbates their suffering. And this is an attempt to help them turn on those defenses so that they can face and experience their true feelings. This is the trigger that unlocks the unconscious. Then there is a download of memories, dreams, and associations which make the origin and the meaning of their symptoms very clear. So there's coherence. Suddenly people understand how this all makes some kind of sense. So I'm going to give you a recent example, an initial consultation with a young woman who was suffering from obsessive compulsive disorder. She was not able to leave her house without returning many times to check on the gas. She was afraid she would hurt somebody. Okay, so I asked her, well, when did this start? And she said it started when she was 6 years old. And I wondered what happened to her at that time. And she said, well, that's when she went to school. And there was some girls in the school who were bullying her. And so she thought it had something to do with that, but then spontaneously said that it had gotten worse recently. Again, I asked her more about that, and she said that a favorite professor of hers had just given an exam in which material that had never been covered in class was featured pretty prominently. And so what we were able to discover by asking about the feelings toward this professor was that she had very positive feelings about her and was then angry. So this was difficult. This created anxiety. But we were able to get pretty rapidly to the feelings of reactive rage toward her with an impulse to just shake her. And as she was getting in touch with that, she said, oh, now this again links back to this particular girl from first grade who was the bully. And she said, but it's even more intense with her. And there was the impulse to punch her, to knock her down. And then spontaneously she said, but if you really want to know who I am most enraged with, it is my former boyfriend who betrayed me and cheated on me. And then as kind of an aside, she said, I had such a hard time after that breakup that I actually ended up being hospitalized. So I asked her, well, were you suicidal? I mean, that's typically the reason someone would be hospitalized in the US. And she said, well, kind of passively. So in other words, she wasn't actively planning to kill herself, but was passively wishing that something would happen to kind of take her out. So I said, okay, well, we better look at those feelings toward your former boyfriend, because that's what triggered all this. And she said, oh, yeah, that's even more intense. Again, she knocks him down, punches him, starts kicking the hell out of him. And then she says, oh, but I wouldn't want to actually kill him, but I would wish it would happen passively. Okay, so there's a lot of significance in using that same word. She said that he was a construction worker, and she kind of wished and thought about him, falling off some scaffolding or whatever. Okay, so at this point, again, we're getting links between the past and the present. And we're starting to see that her fear that she might hurt someone in the future was connected to this wish that she had to hurt people. And so this made a lot of sense to her, and she could start to see the kind of meaning in her symptom, and that it really wasn't necessary for her to keep herself in check in this way. And yet, for some reason, and this is where it's also fascinating to look at the unconscious alliance in the therapist, I said, I'm still having a hard time understanding why you would be bullied, because you're really lovely. She was attractive, bright, easy to relate to, not the kind of kid that's typically bullied. And she said, well, yeah, I think that she was jealous of me in a way. So first she said, I think it's because I was kind of nerdy and liked learning, and they were all into clothes and things like that. And then for some reason I said, well, that old saying, hurt people hurt people. And then she said, oh, that's it. I think she was jealous because her parents were very wealthy. And they kind of threw money and things at her, but they were actually pretty absent and quite neglectful, whereas my parents were really loving because, I was adopted. And I said, oh, so is that something you always knew, from the earliest time? And she said, no, they told me when I was 6, right? And so she had never made this link. She thought it was because of the bullying, but on a deeper level, it had to do with this revelation that her parents were not her biological parents, that she had been given up for adoption by her biological parents, who were teenagers at the time. And so what we then discovered is a lot of very intense feelings of anger and rage toward both the biological parents who gave her up, toward her adoptive parents who hadn't told her previously. But again, she really loved them, and they were very good to her. And so she had a lot of guilt about that. And she could really see how she had been sort of torturing herself with these symptoms. And so, again, the multiple meanings of the symptom were revealed. And in this 1-2 hour consultation, she was able to make very deep sense of these symptoms that had baffled her for years, and that had actually proven resistant to the kinds of treatments she had been receiving, including really at the time, right, that she sought out this consultation. She was in a behavioral kind of treatment, where she was supposed to stop doing what she typically did to allay her anxiety. So she really felt no need for any additional treatment. She felt much better. She felt like she really understood what this was all about, and that she did not need to contain herself. She was not actually dangerous, and also that she did not need to punish herself for this guilt that she felt, that she could really understand how she would have all these intense mixed feelings. So I hope this is a good example of how through this procedure of ISTDP, with pretty reliable ways of opening up the unconscious, that we're able to discover there is coherence and meaning. Now, of course, Bruce Ecker has really created a whole treatment called coherence therapy around this idea. And he has discovered that there are a number of treatment methods that pretty reliably get to this end, and ISTDP is one of them. So I hope this is helpful to you, and I hope that you're able to discover, along with your patients, the unconscious meaning of their symptoms and suffering. Thanks, and Happy New Year to everybody.